Hi everybody, this is our signature facial rejuvenation treatment. It's called Sabah.
What's up everyone? This is Lai Ann here. Welcome back to my channel. In today's video, I have such a great honor to invite Dr. Charles Lee here to share with us about the new phase of beauty, which is plastic surgery. Dr. Charles Lee is a board-certified plastic surgeon with 30 years of professional clinical and surgical experience. He has an experienced team of dedicated aestheticians who are collectively committed to providing you the best to stay young and beautiful. For those of you located in Kota Kinabalu, Sabah, Malaysia, you are very lucky because you will get to pay a visit to Dr. Charles Lee Aesthetic Plastic Surgery and Medical Spa located in Gleneagles Hospital, Kota Kinabalu. Dr. Charles Medical Spa is the ultimate one-stop aesthetic center for personalized, professional aesthetic medical service in Sabah, which offers state-of-the-art high-tech clinical procedures in non-invasive aesthetic method, laser surgery for varicose veins, and cosmetic surgery. The environment of his medical spa is elegant and tastefully furnished to provide an ambience of confidentiality and trust that only experience can provide. So, guys, please help me to welcome Dr. Charles Lee.
Hey.
All right, hello, Dr. Charles.
Hey, hi.
Hey.
It's so cool.
It's
So,
good.
yeah. Why not? It's cool.
So, how's everything in Kota Kinabalu, Sabah right now?
Well, especially when we're having this COVID time, we're making the best of everything, and in a way, I'm quite happy because you know why? I'm able to connect with you, Lai Ann.
Across the ocean.
It's a great time to connect, and congratulations! I love your YouTube sites.
Thank you so much.
Yeah, fantastic. Well, anyway, so have you been to Sabah?
Yes, I did. I've been to Kota Kinabalu a lot of times because I used to work in oil and gas industry.
Ah,
so
nice.
I went to KK for my offshore work.
Oh, okay.
Yeah,
well, I came here in 1989, so that's like 33 years ago.
That's when I was born. That's when I was born. 1989.
Yeah,
oh
cool.
my god. That's why, guys, you see Dr. Charles Lee has so much experience in what he's doing. In fact, that's where we are going to uncover and discover what is it
That's right.
plastic surgery industry.
Right. Yeah.
A lot of, especially ladies right now. Even men. We are all very interested, right? To further what exactly the plastic surgery industry.
Yep.
Yeah.
Well,
So we have I have quite a number of questions for you, Dr. Charles, today. All right.
Good.
The whole idea, of course, for this interview, for this show, is basically to share with people out there, what exactly plastic surgery industry like, and what is the requirements, and what is your day-to-day routine like.
Sure.
I think this is not a lot of people get to see that and get to experience that, so it is amazing, right, to have you especially you have so many experience so long in this industry.
Sure.
All right,
Yeah.
so let's go. First, Dr. Charles Lee, of course, the first question is, why plastic surgeon? What inspired you to become a plastic surgeon?
Well, fantastic, because once again, thank you for inviting me. And if I go back, I've been a doctor for 40 years, right? And I've been a plastic surgeon for the last 33 years. And there was no real calling to do plastic surgery as a career. I just wanted to be a doctor. I knew I couldn't do anything else. My dad was an engineer. So you know, there's no such thing as following my dad's footsteps or whatever. But so I got into medical school and finished off my medical training. And then when I got into the surgical program, I knew I wanted to be a surgeon. Okay, I could never do anything else. I didn't know how to put a stethoscope through and do medicine, but I wanted to do surgery. And when I got into my surgical program, I started to realize that there was something inside of me, which was a creative potential inside me. I loved being creative, you see. And so plastic surgery, you know, it comes from a Greek word called plastikos, okay, plastic, you know, and plastikos means to mold. And cosmetic, when we hear the word cosmetic, it comes from a Greek word called kosmetikos, which means to adore. So that's why when people come and see me as a plastic surgeon, they think I put plastic inside, you know, their face. So I always jokingly tell them, you can choose between Tupperware and Kongware, and you know. So it was during my surgical training, Lai Ann, that I realized I wanted to be able to create something out of nothing. And that's why I chose plastic surgery, because I was very interested in children born without ears, deformities. I was intrigued with cleft lip, you know, born with cleft lip, cleft palate. And really it is when I started to do reconstructive surgery, I found myself. And I think anybody choosing a career, you got to find yourself. You got to find what's in you, because it's going to be a lifetime career. Right now, when I look at you and I see what you're doing, there's so much of what is inside of you coming out. And it's just one letter called P, passion. All right. So surgery for me. So that's why I embarked on plastic surgery. I knew that I didn't like general surgery. I couldn't do anything else. But I was inspired by the whole concept of creativity. And through that channel, I realized that it was about aesthetics and beauty, and you know, the whole thing wrapped up into one. And I knew that that was inside of me, the creative potential of what I wanted to be, you know. And that's why I chose plastic surgery, not because I thought that, you know, I didn't think that it was going to be a glorious thing and I'm going to see beautiful women and all is about boob jobs and, you know, the kind of thing, you know. But it was the deformities, it was the children born with clefts and how to reconstruct them, you know. And so, I mean, you know, till today, right now, I'm still working, I'm still operating, and that passion inside of me is still burning. And so there you go. So I didn't follow anybody's footsteps. I just developed myself within me and started to realize. And I think that goes for any career. You will find that as you're in a career in medicine, there are so many branches. And then you will find that in that you will choose what you want to finally specialize in. But it's a long road, my dear. It's a long road.
It is.
Before you hang up the signboard that says plastic surgeon, you know? So,
yeah, exactly. That's what brought me to a second question, right? Which is what it takes, right, to become a plastic surgeon. Like, what is it, the process like? How many years of studies and what is required?
Well, listen, if I can give any advice to somebody embarking on a career in medicine, especially if we're talking about plastic surgery, there's one field that is very, very supportive to the whole industry of plastic surgery, and that is psychology. So if there's anybody out there that is doing a college degree, psychology is a fantastic basic degree to embark on a road to plastic surgery, because it's all about interpersonal skills. It's all about connecting. It's about meeting a beautiful woman like you and trying to find out where's the beauty coming from. And you know, so psychology is a big part of plastic surgery. And so if I had done 3 years of psychology, if I had done clinical psychology, for example, it would have been helping me a lot in my career. So there you go. So there are some who would have done 3 years. I went straight to medicine, and it's a 5-year course. And after medicine, 1979, I graduated with my medical degree. And then after that, I came back and then I got into 2 years of housemanship. So 1 year. In my time, it was 1 year. Now it's 2 years. So that's 7 years already.
Okay.
And then, and then after that, you want to do surgery. So you go into a program for 4 years as a resident in general surgery. So 7 plus 4 is 11 years. And then during that surgical training time, you go and do your fellowship, which is a postgraduate degree. And so I went to England and got my fellowships in 84, 85. And then during my training as a general surgeon, I wanted to do plastic surgery. So that's another, added 2 years. So today, if you do your basic career 5 years, you do 2 years as a housemanship, and then you do 4 years in your general surgery training, and then you have to do another 4 years of what is called fellowship in plastic surgery, which you can either do a master's program at the University of Science, Malaya, USA.
Okay.
You can do it there as a master's program, or you can join the 4 years fellowship program that we have at the University of Glasgow. And then you come out as a plastic surgeon.
Wow, so like
14
how
years.
14 years.
Yeah. So when I got my degree and my fellowship in plastic, I was like 33 years old. And so it's a long journey, you don't get it just quick. And people have this conception that plastic surgery is nip and tuck.
Yeah.
You know what I mean? But it's a long road, yeah. And
Wow.
Malaysia, you need to be board certified.
Board certified in Malaysia.
Yeah.
And how's the process like? Can you briefly tell?
Like I said, once you've gone through the whole training program, we have an association called the Malaysian Association of Plastic Surgeons. It's called MAPAS. So when you are board certified, means you are recognized by your fellow peers. To be, that means you've had the right training, the right amount of experience, you've been exposed in the right recognized universities, and then you become board certified. So we are living in a world today where a lot of people are doing a lot of things which are not in their lane. And unfortunately, the media is toxic. And that's why this interview with you is fantastic to educate people on where to go and what's safe and what's the current. It's all about the media sort of contaminating careers, you know what I mean?
Exactly.
And so I think so that's where it is. That's how you become a board certified plastic surgeon. You need to be recognized by your board, your association. Like in America, they have an American Board of Plastic Surgeons. Malaysia, we have our Malaysian Association of Plastic, Aesthetic and Craniomaxillofacial Surgeons. And they will certify that, okay, I'm not board certified, that kind of thing. All right?
I see.
Yeah, so it's a big field. It's a big field. And, and of course, aesthetics, when it comes to beauty, that's a field altogether. So we have got today aesthetic physicians who are out there in the marketplace. So clients and public need to know that when they go to a doctor and they want to be beautiful and they want to do aesthetics, just make sure that that person has got a licentiate and credential by the Ministry of Health of Malaysia, that they have that particular certificate.
Okay, wow, this is very informative because and that's why, because everywhere actually aesthetic clinics right now is like booming mushroom, like everywhere, like aesthetic clinics and well, Dr. Charles, you just mentioned is like really, really good because people need to, we need to do our own due diligence as well, right? As a customer, visiting aesthetic clinics.
Sure. And the important thing is the concept of beauty,
Exactly. And then that's what I want to ask you the next. It's like, so what does beauty look like according to a plastic surgeon? How do you actually define beauty?
The famous saying, beauty is in the eyes of the beholder.
Yes.
And in fact, every scenery is beautiful. It's just that how you look at it and interpret it. All right.
Yeah.
So we are all born beautiful. All right. And in my industry, beauty actually, or rather aging, starts at the age of 20. People don't realize. They think, I'm 20, I'm still young and I don't need this. I don't need to look after my skin. I don't need to watch my this and that. Actually, aging starts from when you are age of 20. All right. So whenever I give my talks, I say, okay, beauty starts at the age of 20, you're born beautiful. At the age of 30, you need to make a decision to stay beautiful.
Okay.
At the age of 40, you need to be committed to the decision you made when you were 30.
Okay.
Okay? And then when you are 50, it is investment time. You
Investment time.
You invest in the decision you made when you were 30, in the commitment you made when you were 40, and then now at 50, and it's investment. You know what I'm trying to say?
Yes.
So I get girls like you, and they come in very early, 20 years old, 30 years old. They want to stay beautiful.
Okay.
And very interestingly, this question you asked me is fantastic. They did Euromonitor, did a survey of 20,000 consumers across the world. You understand? And they wanted the top 10 definitions of what people thought was beauty. Okay. And so I'm going to read up the top 10 to you because it'll be very interesting for those watching you and your audience,
Yes,
and these
please.
are the top 10 definitions of beauty, all right? Honesty, simplicity, keeping a youthful appearance, looking your best, looking presentable, inner confidence, being comfortable in your own skin, hygiene and cleanliness, and looking healthy, all right?
Yes.
These were the top 10 definitions of beauty. So if I were to ask you, give me your top 3, what would you consider as being beautiful?
Being comfortable with my own skin, definitely.
Okay.
And then looking healthy
Right?
is definitely one of them. And just another thing, beautiful to me also, you look confident. Like as long as you are being yourself, being confident with yourself.
Fantastic. Well, you hit score. You're fantastic.
Thank
Okay.
you.
So the top 3 was this. Number 1 was looking healthy.
Yeah.
Number 2 was hygiene and cleanliness, which was very important aspect. And thirdly was being comfortable in your own skin. Top 3.
Yes.
So you are forever young.
Thank you.
So
That's so
that's
cool.
why there's no real definition of beauty, but it's your concept, your idea. And a lot of people forget about this whole concept of looking healthy. They come and see me, they want laces, they want threads, they want fillers, they want everything else except asking, how can I get my skin quality better? All right, so I think this is the whole concept. That's why we have all these our YouTube channels and all that, is to educate people to because you're born beautiful. So in life's journey is to stay beautiful from within.
I love that.
Yeah, and I always say this, appearance is the most public part of the self. Okay, I'm looking at you. It's appearance. It's the most public part of the self. How you look introduces yourself.
Wow.
Okay, so that's very important. You don't need to say anything, but just looking at you, you have already made an introduction, which is better than a referral letter.
Yeah.
So all those who are going for job interviews and they're looking for a career, basically, you got to just look yourself, which is better than a testimonial.
Yeah.
And so that's why in my profession, Lai Ann, radiance must be personal.
Radiance must be personal.
Radiance must come personal. That is, must be within you. If anything you do for your face, if it's not felt from within you, then it's just a mop-up job.
Yeah.
Okay, so this is the whole concept of beauty, where radiance becomes personal, and I always believe that beauty and science must meet.
Okay.
And where beauty and science meet, that is what is called smart aging.
Smart aging. I like that.
So I don't like the word anti-aging, because all of us have to age anyway. But the concept for you and for me is smart aging, because you know why?
Smart
The word
aging.
smart has the word art in it, A-R-T, smart.
Oh, you're right.
Okay, so that's why you need to learn the art of how to age smartly.
Wow.
That's the whole concept.
I love your whole concept of,
Yeah. So there you go. Yeah.
Exactly.
So I get all sorts of people who come and see me and they want to get fixed up.
Yeah, exactly. So what? Is it because they feel bad about themselves, or it's more of like a self-esteem issues?
Yeah, I think that is a very high percentage of them. That when they come in, there's always that's why I said doing psychology is part of your learning curve before you go into a career in plastic surgery. Because everyone who comes to see me or see a plastic surgeon, they have expectations. And so there are those who are very happy with their results. And there are those who are just not happy at all, no matter what you do. And even if they look beautiful, they're still not satisfied. Okay? So there's always the good and the bad of every profession. And for me, it's usually the self-esteem within them. And either it's body image or there's something in the face that they don't like. And so we take a lot of time counseling, a patient to find out what's happening on the inside, because beauty is from within. If I can sort out the problems from within them, they are already glowing before I can do anything.
Yeah.
Okay, so these are the concepts of, so that's why people have to be very careful about quick fix. I used to get phone calls, people will call us, do you do skin whitening? And really, and then I would reply, I said, look, if there is something called skin whitening, I also want to do it, man. I can be like Michael Jackson, get fairer and fairer, you know what I mean? But
Yes.
It's the concept, see, of the media and what's happening in the world. Like, for example, one of my most popular treatments is what is called PRP with Z-lift, which is called actually plasma lift. It's something that I developed. But in the world, they call it vampire facial.
Facial.
Yeah, because a celebrity called Kim Kardashian did it. And she had blood all over her face. And today, they call it vampire facial, which is an abusive term to a beautiful procedure. So it's the concept, So when they call my clinic and they ask my staff, does Dr. Lee do vampire facial? So they say, no, he doesn't go out at night and take people's blood like vampires do. What I mean? He does a professional facial. So there you go. So that's basically, yeah. So over the years now, I'm doing more of aesthetics because people are now wanting more and more non-invasive surgery. They don't want the knife. They don't want surgical procedures. They want aesthetics. And over the last, 35, 40 years, technology has changed. So so we can get people looking a lot younger by just using technology today, high-tech technology, to get their skin really looking good. So there you go. Exciting.
And how do you actually consult the patient? Let's say, like, for example, those who call you, but for those who walked in and then, okay, Dr. Charles, now I want to fix whatever I have. So what will be like the consultation process like? Like, how do you actually give them advice?
Right. Well, that's a terrific question, because my girls, when the patients come to my clinic, my girls go through a questionnaire with them and spend some time with them to find out whether they're really comfortable in the biggest envelope of the world, and that is the skin. If they're comfortable, and what's the problem, what's really affecting them. And once you understand the basic problem, my job is to solve that problem within expectations, so that so we don't overpromise them, but we try and tailor make what we do to what they want. And so we get them to a better place, a safer place where they're comfortable with themselves. And so the consultation is basically to find out what is the problem. So if I get a patient who comes in with aging, she's got wrinkles, she's got some lines like I have, and she wants to look younger. Obviously, aging is a three-dimensional problem. So when I look at somebody's face, I have to understand what is happening with the bone, what is happening with the muscle, what is happening with the soft tissue, what is happening with the skin.
Oh, okay.
So the whole consultation is always an inside-out process. Because if we don't fix what's happening inside, whatever you do on the outside is a whitewash. Okay? It's like, if there's a crack on the wall, all right? You can't just paint over it. You bring in the sifu, he goes and puts some cement, he'll go and patch it up, he'll scrape it, and then he paints it. So unfortunately today, a lot of people want quick fix.
Yes.
So they go and get their lasers done, they get their local spreads, they have fillers, they have all sorts of things done, Lai Ann, except finding out what's the problem with the skin quality. Because if you get the skin quality looking good, then you find that it just heals by itself. You know, it's all about cell regeneration today, and so that's how we do a consultation. I always spend time finding out 4 questions. How are they? You know, what's happening to them? How do they feel? How is their skin acting on them? How does the skin behave, and how they feel with their skin on them? Okay, so if you go through these 4 emotions, then I kind of like nail it down to what they have. And then of course budget, you know, they'll always ask, what's the price? What's the price?
Yeah.
People always have this misconception, plastic surgery means expensive. You know what I mean?
That's true. I mean, that's what, it's normal, the normal impression.
Which is absolutely not true. Because, you know, we have procedures here that can cost 399 ringgit, right up to 10,000 ringgit. So a lot depends upon their budget. But you got to fit a tailor-made procedure. Everything is personal today. It's personalized treatment. That's what I'm telling you. It's tailor-made. So with my 33 years of experience, I will tailor-make what is I feel best for the patient. And it's always inside out. You deal with the inside first, and then you find out what you can do from the outside. And so there you go. It's an art.
It's definitely an art. Like you say, it's a smart art.
Yeah, the art in smart aging.
Yeah. So
yeah.
What are your daily routines like, Dr. Charles, like as a plastic surgeon? Before the lockdown, right? Like before the COVID-19.
Yeah. Well, over the years, obviously, I've specialized in a niche market. So, you know, we used to do breast surgery, tummy tucks, eye bags. So I only do what I like to do when it comes to surgery. But the only plastic surgeon in Malaysia that does what is called laser for varicose veins. All right.
Okay.
So these are the veins in the leg that, you know, they swell up and they become bulging and they look like very ugly bulging veins. So in Malaysia, I'm the only plastic surgeon that does laser work for that. Because that is usually done by the vascular surgeons. You know, people who do vascular surgery, they normally do that. So that's my niche. I love that. Where we put in wires up, you know, laser up your vein in the leg, and then we close it down. I like to do that. So basically, but now over the last 5 years, it's more of aesthetics. So we have an aesthetic medical spa. You should come here, Lai Ann. Come on.
I will definitely when this travel ban lifted.
Just let my girls, Bonnie and Mary, pamper you. You know what I mean?
I can't wait.
Yeah, so it's more of aesthetics today. And my top work is plasma lift. So we have what's called hydrofacial first. So we get skin all cleaned out by a non-invasive resurfacing of the skin called hydrofacial. And then after that, we take your blood, we spit it. It's called PRP. But we mix it with something called Z-Lift, which is antioxidant. So I'm a big fan of anti-aging. And so this is the reason why it's when people end up doing a procedure, they always ask me, doctor, I pay so much, how long can it last?
Yeah.
you know, I pay so much, I do this, then how long can it last? The question is not about how long can it last, it's about how much younger can I get your skin look.
Wow.
Okay? That's very important, because if you know, like if someone walks in, they're 35 years old, that's the chronological age. All right? You know, I see your birth date, your chronological. Yeah. What I'm interested is the biological age of the skin, which is usually older. And so what we do is I do a principle of organic farming. You know, it's like farming. So your skin, piece of land, and you take out all the rubbish, the lalang, the thorns, everything, clean it all out. And then you put the seeds in, you put the baja, which are called fertilizer, which is your own blood growth factors. And then we add, you know, antioxidants, we bring in light called LED lights, low level lights, and just we water the skin. So we grow it, we feed it, you grow it.
Okay.
So we
That's good. So
we feed the skin with all the good stuff, and the
Mhm.
patient goes home with all the home care products to feed what has been planted. And that's how you sustain and get the best skin. It's all about skin health for life. It's a fascinating field. You gotta love it to do it.
I mean, I'm intrigued already, right? But like, I'm excited already. Wow, how can I actually feed my skin and grow my skin? You know, like I'm now 31 years old, so like you say, it's time, you know, to
Yeah, correct. You see, because the clock always changes 30, 35, 40, 40. You know, as the hormones start hurting us,
yeah.
the hormones do a lot of damage too. So you can't stop the aging process, but you can reverse it and stall it. And that means feed it with the right stuff, not some of the stuff that you get out in the marketplace, but it's all medically graded, and so patients want the real thing. You know, more and more Asians are looking for evidence-based medicine.
Yeah.
So my patients will come in and I will teach them, like medical students. You know, I will show them the model. Let me get my girls. Where's the model, please?
Oh, that is so cool.
And okay, so yeah, anyway, so whenever they come in here, I'll always show them this model.
Okay.
Okay, and I always tell them everything about plastic surgery looking beautiful is all about this area here called the cellular matrix. So people want a quick fix on the skin on the outer layer called the epidermis. But I invest everything in what's called the dermis and the cellular matrix. So it's a method called matrixing, which is very important. So like anything, you can't build a building unless you get the ground sorted out.
Yeah.
So you can get people piling and piling and piling for years, and suddenly you find the building up. So we do a lot of inside work first, cleaning out the system, cleaning out, you know, the lymphatic drainage and all that. And then we do something on the outside. Voila!
Voila. Seriously. Yeah, like you say, it's inside out, right? Beauty starts.
Beauty starts from.
Yeah, beauty starts from within. Exactly. So, but how does COVID-19 actually affecting the plastic surgery industry? Like from your see, like what changed after this new norm? You know, we all.
Number one is, of course, unfortunately, it is fear. You know, I don't have a private clinic. I'm in a hospital-based setup. So COVID-19 has really affected us most of all, because in my profession is very much equated with the economy. And so people are able to afford it, they come and see us and they get things done, you know. So it's affected me especially, I mean, my industry very badly, because number one is there's no urgency. Okay, so nothing is urgent. So, but we do a lot of virtual consultations, and people come in here, and we are very busy with our medical facials, our super facials, because this is the best place. It's the cleanest, and it's the safest.
Yeah, exactly.
So they come in here. We have a medical spa, and so they come in here. My girls, you know, they've got their mask on. Everything is clean. They get a super medical facial done. And so that is a practice that's going on, but definitely, you know, it's tough, and so that's why we do a lot of consultations virtual. Virtual consultations, and then they come in here and they do it, but it definitely has affected us, affected me. So hopefully they will get over it, and you know, and life will start all over again in the new normal.
The new normal, but I mean, honestly speaking, for me, right, like this 2 months of lockdown, like MCO here, like my skin, like I was like, oh my god, I need to go for my facial, you know, like seriously, I saw so many bumps and all this pimples up, you know.
Correct.
So, man, but the thing is that right now, I mean, yeah, beauty salons, medical clinics is not being lifted yet, right? The ban. So,
but you can come here. Once the airspace is open, come on here. It's the safest place.
Yes. Definitely, I'm gonna clean out all this one. How I don't know how many. Not just 2 months. You know, it's been like even before lockdown, right? I haven't been visited any facial, so I was like, oh my god,
true.
months.
Yeah. True.
Like,
it's important. It's important because remember that these skin cells die on us. So every 2 weeks, the keratinocytes are shed off. And so I always talk about this exfoliation, which is so important. And so get all those dead cells, get down to the germ layer. So hydrofacial that I have here is a medical facial. It's a #1 in the world regarding a non-invasive way of resurfacing your skin. Gives you a lovely, gentle peel. And then after that, we put in all the antioxidants, which is very important.
Oh my God.
That's really going out well. So yeah, there you go. So we're managing okay, but it's tough. It's really tough. And but there are other ways of, talking to my patients, and we normally have this discussion like what I'm doing with you.
Okay.
We do that consultation over virtually.
Okay.
Then when they're ready for it, we're booked out. So we have a very good prepaid kind of gift system that's going on. So, so they can get onto the YouTube channel. We've got an Instagram.
Nice. Yeah. How can people reach out to you? Let's say I want a virtual consultation with you. How can they?
Okay. So the first is to call us in the clinic, 016-824-5224.
Okay.
That's our clinic number.
Basically, we will put there will be a caption below. So the Dr. Charles number.
Sure.
Alright.
Yep. And we are based in Kota, Kinabalu. I'm Gleneagles Hospital. And so we have Instagram, so they can come in there, Dr. Charles Lee Sabah.
Okay.
Instagram, so all my procedures are over there. And then have a Facebook, Charles Lee Aesthetic Surgery. And then of course YouTube, anti-aging with Dr. Charles Lee.
Exactly.
So we've got some YouTubes. We're on Twitter. So
Twitter.
Yeah, Dr. Charles Sabah. And I have a website, drcharleslee.com.my. So we're all in the social media because 80% is marketing in plastic surgery. We have to market, and we market truth, and so that's very important. People want to understand evidence-based medicine.
Yeah.
And so the more they understand what they are going in for, they're already in a different platform altogether. And I'm enjoying this session with you. I wish all my patients are like you and clients all fired up.
The pleasure is mine, Dr. Charles. To have you explain to us how plastic surgery industry.
Sure.
How is it?
Sure.
And this is a very, very informative and very, very great sharing from you.
Thank you.
And I thank you for coming here.
My pleasure.
And so, guys, please, you have to follow Dr. Charles. Subscribe to his YouTube channel. His channel, oh my God, so amazing. He has give you so many excitement in terms of unboxing. I love those unboxing that's going on.
Cool, huh?
It's very cool. Seriously, ta-da! That's kind of. So check out his YouTube channel, and of course, please reach out to him. And for a virtual consultation, and Dr. Charles will be very, very happy to help you, and that's how we actually started this session, right? This interview session, and that's how, because I reached out to him, right, to share with us more about plastic surgery.
Thank you.
Thank you so much, Dr. Charles, for having.
Thank you for having me, Lai Ann. And listen,
no problem.
Stay beautiful.
Definitely, stay beautiful.
Stay safe.
Stay confident.
Okay, bye. Take care.
Take care.
Bye.
So that's all for me today. I hope this interview with Dr. Charles Lee brings you some value-added insights into the plastic surgery arena and what is the life like of a plastic surgeon and what the requirements are to become a plastic surgeon. Also, I run a private Facebook community where I'll be going in live to share career tips and personal development tips. So if you are interested, please click the link in the description box below to join us. Also, if you like my video, please give me some thumbs up and likes and subscribe to my channel. You will get a free video every week. And with that being said, I wish you a great day, and as always, good luck and all the best in your life journey. Bye for now. Ciao.